You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtina.com. On this episode of the Dr. Tina Show, I got to sit down with Dr. Taylor Bullock. He is in his final year of residency in dermatology, and I discovered him recently on Instagram, and I absolutely love his content, and so I had to get him on the show. Dr. Bullock just has a very commonsensical approach, and when I got talking to him, I realized he had a more interesting background in nutrition and actually a more holistic perspective, whether he realizes it or not. His Instagram is phenomenal. I've learned so much, and the reason I brought him on was because you guys were asking for a more thorough discussion around skin cancer, melanoma in particular, since I had shared out last year that I'd had a melanoma scare that turned out to not be melanoma, thank God. And also the ever controversial topic of Botox, because I get asked about that all the time, and I actually take a lot of heat for it because I have admitted to using it in the past, which I do not apologize for. But we had a great candid discussion all about neuromodulators. And as well, we talked about different skincare options for those of us who are trying to age optimally. So I hope you enjoy this as much as I did. It was a really fun and informative conversation. Let's jump in. Dr. Taylor Bullock, thank you so much for coming on the Dr. Tina Show today. I'm so excited to have you here. I have been following you on Instagram for a couple months, and I love your content. You specialize in dermatology, and you are, in my opinion, very holistic and common sense in your approach to things. And so I'm really excited to have you on the show today.
Thank you so much for having me. It's an honor to be here.
Yeah. So tell the audience a bit about yourself, because I've only gotten like a quick preview, but you are a dermatology resident, you're a physician, and you have a really unique background.
Sure. So I'm a dermatology resident. I'm in my last year of residency. It's kind of funny, Dr. Tina, the more I kind of, learned about you, the more I've realized we share a lot of commonalities. But I have actually a really good background in nutrition, which is funny because you'd think physicians would know a lot about nutrition, but we might get maybe one day, maybe 4 hours of nutrition in medical school, which, for physicians seeing patients every day, they should know much more than that. But something that makes me unique, I have a background in nutrition, and now I see patients every day in dermatology.
Yeah. I saw something this morning. I actually thought of you because I knew I was going to interview you today. It was a strength and conditioning coach, and he, there's always this turf war online of like, it's really fun to bash doctors for not having the education that they don't have. And, there's this, at least in my world of sort of functional medicine and a lot of the strength and conditioning community, the nutritional therapists, there's sort of this move to bash doctors and be like, doctors don't get any nutritional training, so why are they trying to be experts in it? And he said something like, don't mistake your 15 hours of nutritional training for my decades of real life experience with clients or something like that. And I almost wrote on the post, they don't even get 15 hours. But
it's so true, though. It's so true.
I didn't want to add to the physician bashing because that's really unfair. I'm usually the one even though I'm a naturopathic physician and I'm not, like I actually chose to reject allopathic medicine. That was the path I was on. I truly believe we're all here to help the patient. We wouldn't go into this kind of debt and commit these kinds of years to study and residency and all of that if we didn't truly want to help humanity, So anyway, I appreciate your approach because I could just tell. I had no idea your background, but I was looking at your posts and I'm like, he makes sense. Like you're making so much sense out of concepts like you're talking about Botox and you're talking about all these different aspects of, skin. And I'm like, he's making too much sense to not have something more in there,
Yeah, no, I couldn't agree more. And it's hard because I think we're all just trying to help each other, but you can't, it's hard for the physicians. We really just don't get much training in nutrition. I find myself talking with my colleagues all the time, does dietary cholesterol really affect our blood cholesterol at all, right? Just things that we don't learn in medical school.
It's true. And unfortunately, medicine's kind of gone down a pathway, and even in my world of functional medicine, I mean, all of it's gotten somewhat mucky. There's a lot of pharmaceutical industry influence. There's a lot of administration influence, and doctors, I think at this point are often too scared to speak up because there's somebody above them telling them what they can and cannot do. And I just yeah, it's kind of broken my heart, to be honest with you. But anyway, I digress. Your
I agree with you.
Instagram,
I think the ones that are the loudest are usually the ones that are most biased. Just saying that, maybe not everyone is biased or wrong, but I do think the ones that are the most outspoken tend to be the ones that are, the most biased, or, not necessarily the ones that might know, the truth or what's going on.
isn't that the Dunning-Kruger effect? Isn't that where you think you know more than you know? Isn't that what it's called? That's where, it's like the idiots think they know a lot, and the folks who actually know a lot become more humble and quiet.
I think you're right. And, it's a very scary thing, to be honest.
Yeah. Well, I can imagine too in your world. So one of your posts that really caught my attention was you were talking about melanoma and the genetic predisposition that folks will have, and that it might be less about the sun than it is about genetics. Can you talk about that a bit? Because I have thought that for years, and I have never heard anybody in the world of dermatology say it out loud.
Sure. This is I won't even say controversial topic, because it's a very, most people don't even know about this. But I won't ask you this question, because I already kind of know how you feel. But if you were to take a bunch of physicians, sit them in a room and ask them how much sun exposure increases your chance of getting melanoma, and I feel like I can say this because I've actually seen groups of physicians get asked this, they might say that sun exposure might increase their chance of melanoma by maybe 10-fold, 20-fold, 30-fold. But in reality, all the studies we have suggest that increased sun exposure might increase it to maybe 1 to 2 times more. It might increase your chance to 1 to 2 times more likely to develop melanoma with sun exposure, which may or may not sound a lot. I think it's all perspective. But let's compare that to smoking, for example, and lung cancer. If you're smoking, you're going to have, again, the studies show different things, but depending on what study you look at, 10 to 30 times more of a chance to develop lung cancer. So if we're telling people not to smoke, we're helping them, really not get lung cancer. But with melanoma, if it's really somewhere between sun exposure giving you 1 to 2 times a chance of developing melanoma, it's really not that much of a difference. And I know I'm already on my, I've spoken a long time, but let's talk about African Americans. They have a 0.1% chance of developing melanoma. So let's say one gets lots of sun exposure and their chances double, they have twice the risk. So that goes from 0.1% chance of getting melanoma increased to 0.2% chance of developing melanoma, which really, both those numbers are really small. I'm not sure it's really a big change.
Well, and considering the rates of vitamin D deficiency in that population as well, because they have more melanin, so they're not making vitamin D as readily, which, I mean, I always joke, which I'm sure you don't totally agree with me on this, but I love this. Obviously, I love the sun. I'm tan right now. I always joke that I will take my chances with the sun and the potential, skin cancers that may come, which I think basal cell carcinoma really doesn't scare me nearly as much as they seem to want to make it out to be scary. I mean, these are the chances of basal cell carcinomas going deep and metastasizing, that's the least scary skin cancer in my opinion. I want your opinion, but that's my opinion.
No, I agree. I mean, I have things to add, but I agree. I do agree with what you're saying.
And that's going to be the most common one. And then we've got squamous cell, and that's a little bit scarier, and it tends to want to, go deeper and metastasize more readily from what I've researched. But the melanoma thing, when I first started learning about it, I was like, this is not even showing up in skin or sun exposed areas as much as you would think, right? Like it's in the lower legs in women, and it might be on the torso in men. And I have actually found melanomas, though. I will say the melanomas I have found on patients and sent them to dermatology to have it biopsied, they were all in highly sun exposed areas. So to your point, like, yes, it's possible, but I always joke that I'd rather die tan and happy than vitamin D deficient and sunlight deficient, So it's like this risk reward ratio, but I am fully aware of my risks, and I'm going to learn more from you today. But I don't think most people are. I think the industry has done a great job of scaring the crap out of everyone and getting them out of the sun and not even telling them the real risks of what some of these sunblocks do. So anyway, or I should say the sunscreens, the chemical version. So that's the stuff I would love to talk more about today if you have the time, because I don't think people have the real facts here.
Yeah, just from what you said, we have a lot to talk about. I feel like one thing I do have to say, and maybe we'll see if there's even time for this. I do have to say, no matter what, I'm not saying, we shouldn't use sun protection, because, we're talking about melanoma risk with sun exposure. I guarantee, melanoma aside, if we were to, have a discussion, I could give you, a run for your money why you should be wearing sunblock or sunscreen, or, sun protection. But also, I don't know if you knew this, but sunblock, historically, we used to refer to sunscreen as chemical sunscreen and sunblock as physical sunscreen. But sunblock theoretically doesn't even exist anymore. The FDA actually, I don't know if you're familiar with this, but they actually said you can't use the term sunblock.
Oh,
that was,
I did not know that.
A decade ago.
So there's mineral sunscreens and there's chemical sunscreens. And I'm not a fan of chemical sunscreens, but I do use mineral sunscreens, which I think are more of a mechanical blockage. And there's issues there, right? Like you could have them be nanoparticle and that can get into your skin and that can ruin reefs. So I'd love to hear, like, what are your favorite versions of sunscreens and how do you suggest people use them?
So I always say this. I've got a couple favorite sunscreens. People always ask me, what would you recommend? And I have to say, the sunscreen I would recommend for you would be the sunscreen that you will wear. Because I feel like everyone has their own opinion. Some people say, oh, it's too thick. Some people say, oh, it's too thin. Some people say, oh, it leaves a white cast on my skin. There are so many different sunscreens. It's kind of like, the shoe has to fit just right. You just have to find your perfect sunscreen. I think what you say about chemical sunscreens with, possibly contaminating, the ocean, I think those are all valid concerns, very valid. Are the chemical sunscreens going to be safer or less safe than the mineral sunscreens? Sure, I agree with you 100%. How much unsafe or how much more safe or less safe? I'm not sure exactly. But, you can't go wrong with physical sunscreen, zinc oxide, titanium dioxide. But I think it's just kind of, a decision that everyone has to make for themselves. My favorite is actually just good old physical protection, like wearing a nice, broad hat. You really can't go wrong with that. You're not putting anything on your skin. Again, I'm not against that. You really should just be, protecting yourself against UV radiation. But there's nothing wrong with just wearing great clothing, going swimming with just a nice little shirt that covers your skin. I think that's probably the best thing to do.
100%. I agree with you. I actually made my husband, we went to Hawaii in February and he was ill prepared. I grew up at the beach, so I was ready. And I had my, lightweight, it's not really a rash guard, but you go to the surf shops and you buy these thin, lightweight cover-ups and I buy the hoodies because, your neck and your ears and all of that and the top of your scalp. And he's got a bald spot and I've got silver hair, so the sun gets through more readily. So like just having that hoodie and then the kind that you can put your thumb through. So you actually are like as covered as you want to be. And it's so lightweight and loose. You're not hot. You can pull it up if you want to. But I got him one after day 3 because he was just smearing the sunscreen on. And he was ill prepared. He doesn't ever wear sunscreen. And he didn't realize Hawaii is like a different beast. Like that's, it depends on where you are in the world. The sun can be a different beast. And so anyway, I bought him one. He was kind of resistant. I'm like, no, we're getting you this. And the whole rest of the trip was so much easier. You just put it on and handle it and, put what you need on your face, have a hat, like have a plan, And so having clothing, I completely agree with you. And for women, just having like a light wrap, swimsuit wrap, that's like almost like a giant scarf is also a wonderful tool because you can drape that over you. And then shade, right? Like I'm just really sensible in the sun. I go in the shade when I start to feel myself redden up a little bit. I am very keen to know what that feeling is when you just get that minimal sun exposure and you start to feel yourself reddening. It's like, get out. And my problem with sunscreen is that somehow in the 80s and 90s, when it got really popular, people started losing common sense and would smear this stuff on them, whether it be physical or chemical, and fool themselves into thinking they could just rock it out all day in the sun and drink alcohol and eat like crap. You know, I mean, like what you're eating and what you're drinking has a lot to do with how your skin's handling the sun as well. And that's my big problem with sunscreen is like, it just fools people into thinking they're fine. And I'm like, you're not fine. You need an umbrella, you know, like you need to go in the shade and handle this differently that's all.
No, you're totally right. I think, you know, first of all, you've got to be reapplying it if you're wearing sunscreen. And if it's going to be a hassle to be reapplying all day, I totally agree. Get an umbrella, get some sort of physical, you know, sun protection. It's so much easier. And it's funny you mentioned that story about your husband. I was actually in high school. We went on vacation to Hawaii, and that was when I got the worst sunburn of my life. And I guess from then on, I've really never looked at getting sunburns the same way. I've always just tried hard to avoid them.
Yeah, they're miserable and they can make you sick and feverish. And yeah, we don't want sun damage. And I do think that ingesting alcohol in the sun is a terrible idea. I think anything that's going to make you oxidize, you know, whether it be seed oils, a lot of people want to blame the seed oils for the sun cancer epidemic. And I don't think it's all just seed oils. I think it's just the shift in poor nutrition that we've sort of taken as a society as a whole worldwide. And people just really don't have an appreciation for common sense as often as I think the old ways used to. My husband is from this farm community, and there's so much common sense out here that is not present in the suburbs and the city that I grew up in. You know, people just have a different appreciation for the land and the sun and how it all works together. So anyway, okay. So next question. So you were talking in your reel about how melanoma has a genetic component to it. Can you talk about that a little bit more? Because I know we touched on it, but dive in deeper because people really don't seem to understand this piece.
Yeah, this is fascinating. So we think of, for example, I love twin studies. Twin studies are fascinating because, you know, you take a set of identical twins and their DNA is almost essentially the same. Essentially, the DNA is the same. And when you look at them, basically all their differences are due to essentially their environment, what they've done to their body, what they've done to themselves. And they did this great study where they looked at twins and looked at all the cancers that these twins had, a bunch of twins. And they found all these different cancers and how likely these cancers were to be tied to their DNA, the DNA that you were born with. And for example, very low down on the list was lung cancer. Lung cancer wasn't tied super closely to the DNA. So for example, it makes perfect sense. If one twin's going to be smoking a lot, the other twin won't be, there's a good chance one will get lung cancer and the other one won't. About midway through the list, there was breast cancer. Breast cancer was fairly genetic, but not super genetic. I feel like most of the time we actually think of breast cancer being a very genetic cancer. We don't really think of us preventing it in any way. We just think of it as something that we just end up getting. And then actually higher up the list, twice as genetic as breast cancer, was melanoma. Wow. Which is very interesting because we really talk about sun exposure with melanoma so much. And again, sun exposure being, you know, increasing the risk maybe 1 to 2 times the risk for melanoma. And if you look back at breast cancer, the equivalent would be like being overweight and getting breast cancer, or being overweight increases your risk of breast cancer by somewhere between 1 and 2. And it's the same with, you know, sun exposure melanoma, that the risk is somewhere between 1 and 2. But I would never, you know, say, we never hear about people saying you need to lose weight, you're going to get breast cancer. I've never heard anyone say that in my life. So it just kind of goes to show how much more we're hearing about sun exposure and melanoma and how little we're hearing it really with any of the other cancers where it would apply in a similar way.
Right, right. Well, I think it's a mixed bag. And the obesity contributes, the metabolic dysfunction contributes, the dietary choices contribute. And, you know, it's a pleiotropic effect in the way that things happen, in my opinion. So if there is a genetic susceptibility, then there's more factors involved than just one thing. And it's really easy. People are interesting online. As your account grows, you'll realize this. People really want this like very black or white. You've probably seen that already. Like, what is the exact answer? What exactly am I supposed to do? And there's just no such thing. And there's no one thing. And there's it's all risk tolerance to me. I don't think people understand nuance as well as they could or should. Maybe they don't want to. I think COVID was really clearly showed us that people really wanted things to be very clear, and it's like that's just not how it is. So I do think that sun damage is not, no bueno. Like we don't want to be cooking ourselves to death out there, but we didn't end up as mammals on this planet without having some life force coming to us from that giant orb in the sky, right? Like the moon heals. I mean, I'm getting a little esoteric here, but like the moon heals us. The moon cycles are important when it comes to menstrual cycles. The sun heals us. And I just think it's so silly the way that it's all gotten very dogmatic. And every time I walk into a dermatologist's office, which is a lot because I have these atypical nevi, so I'm always getting them checked and cut off, and they're always on me. They're always on me about the damn suntan. And I'm like, I don't know, I'm 50. I'm not dead yet. But I'm not out there. I don't want to turn into a leather tortoise either. So I don't know. How do you talk with your patients? Because I mean, what's the going? What are patients thinking out there? How are doctors talking? Like, what's the going conversation?
Well, I love what you said, and I hate to go straight back to the melanoma thing, but it just relates perfectly. We will diagnose a patient with melanoma, and after they'll turn to us and they'll say, "Doctor, did I cause my melanoma? That those 3 times I went to a tanning salon, did I cause my melanoma?" And of course, knowing that, sun exposure might be related loosely with melanoma, but not nearly as much as, smoking and lung cancer.
Right.
Having them think that they were at fault for their melanoma, that's ridiculous. And sometimes we do hear about, some physicians saying that, yeah, your sun cancer is causing your melanoma. Or, on social media, some dermatologists or other people saying, your sun exposure is causing your melanoma. The last thing I would want is for them to go to sleep every night thinking, oh my gosh, I caused my melanoma. And melanoma, sure, basal cell carcinoma, squamous carcinoma, it's a whole different ballgame. Melanoma is very scary. It can spread very quick. It will take your life. It is very dangerous. Last thing I would want is for them to just, feel so shameful of their sun exposure.
Yeah.
So I think the black and white, my answer for my patients is always, no, you did not cause your melanoma. Lots of things go into whether or not you develop a melanoma. Genetics, sun exposure, minimally, but there are many other things that determine whether or not you get it.
Yes, I think that's awesome because, well, and also it's kind of like 6 and 1/2 dozen of the other. I think the cancer rates of any cancer, I think they're saying like 1 in 2 males and 1 in 3 or 1 in 4 females, something like that. Some crazy high level that we're going to develop it in our lifetime. And they don't tell you what those cancers are. I think a lot of them are probably skin cancers. And I was like, oh, okay, well, I've already had that. Like
You're right. Most common one is basal cell carcinoma. Most common cancer of all of them.
Yeah, I've already had that. So I think I have another one growing, and it's like, but I am aware of them, and I know when to get on them fast. It's the scary things you hear, like who was it? Khloe Kardashian had like a small little raised nodule on her cheek, and it turned out to be a melanoma, and then they had to do this massive Mohs surgery, and people get scared away. So I'm just trying to bring a little sense to the conversation because my followers know I love the sun, and they're very worried, some of them, and I want everyone to understand its risk tolerance. If like you and I have very different skin types. Right? Like we can just tell by if anyone's watching the video, and you're much more fair skinned and I am less. And I think that may be somewhat protective too. It's like, how responsive are your melanocytes?
It is. No, you're right. I agree. That's part of the genetics thing for melanoma. You're 100% correct.
Yeah. So
is it because I'm getting if I were to get melanoma, is it because I'm getting sunburned all the time because I just can't handle the sunburns? Or is it because genetically, this is the way my skin is, and that also happens to be associated with the people that are getting melanoma? I mean, it just suggests that it might not be the sunburns. It's just genetically speaking, my composition, the skin, the way it looks, that seems to be more associated with the genes for melanoma.
Oh, interesting.
So it's not necessarily the sunburns. It's not necessarily that I'm getting the sunburns. It's just melanoma has a very high readability. So it's not necessarily the act of getting sunburns. Because I have people with red hair that say that I diagnose them with melanoma and they tell me I've never been in the sun my whole entire life because I can't even handle the sun.
Wow.
And then they get melanoma. So is it the sunburn? No.
So that more of that pale phenotype might just be more highly associated with the genetic propensity for melanoma versus the sun burning the crap out of a pale person giving them melanoma.
Exactly. I mean, you look at, for example, African Americans, much less likely to get melanoma. You might argue that it might be more likely due to the genes that they were, dealt, and less likely to do with, their sun exposure.
Interesting. This is so fascinating. I'm so glad this is happening while I'm still on this planet, because I've really had a bone to pick. When I was in 8th grade, I went on a trip to a lake. Like I grew up at the beach. So I grew up in Southern California at the beach, and we never wore sun. We wore zinc oxide, like straight up, zinc, like blue neon zinc as, it was the 80s. It was all very, very 80s side, ponytail on the side of our head, all that. But I wore this PABA-based sunblock or sunscreen, I'm sorry. And I was on vacation with a family, my dad's business associates, and we were like in Lake Shasta or something on a boat. And it was just different water. Like I just wasn't used to being on water like that, It's just a whole different beast. And I was wearing this PABA-based sunscreen because I was burning and because I was on a giant mirror of water instead of the ocean, it just was very different. And I got the most horrific rash. And my mom takes me to the dermatologist and she tells me I'm allergic to the sun. And I was like, get the fuck out of here. Like, I'm just not.
Yeah.
No. And so I got to say, I kind of went on a rampage since then against this whole sunscreen thing. So I have dug up every article I could find. I have been following this. And then interestingly, I don't know, I might blow your mind here and you might think I'm crazy, but have you heard of easy water or exclusion zone water?
I don't know. Tell me what it is.
Okay, so this doctor named Dr. Bullock, he's up at the University of Washington, and this is legit. Our water in our bodies are not in an H2O composition. They are in a format where they basically become structured and somewhat gelatinous. And we gather energy and hydration through different avenues beyond drinking water. We actually, I'm not doing justice to this. I'm going to send you the book and tell you, you can read it. It's going to blow your mind. But this structured water concept, basically in a nutshell, the way that I understand it is that, and the way it's been described to me is that we are these 3D crystalline structures inside. This is how the fluid in our interstitial and interstitial fluid is. And when we go out in the sun, that is infrared, sunlight, exercise, grounding, the magnetism of the earth, putting your feet on the ground, all of these things actually structure our water up. And that is the healthiest state to be in because that's how the electrons tunnel through our mitochondria most efficiently, is when our water is in that structured state. And so in my head, I'm like, oh, we actually go out in the sun and like crystallize up. Like we literally charge. And so in a way, if we're gathering energy and hydration that's making our mitochondria work better to produce ATP better because of the structured watered state, and the sun induces that, in my opinion, that is like one version of photosynthesis. And I've been saying since I was in school that we have to be photosynthesizing somehow through our mitochondria. And this was back in the early 2000s. And my colleagues were like, you're insane. But they always tell me I'm insane. And I'm like, no, for real. So now all these years later, we actually have scientific data showing this easy exclusion zone water. Your colleagues watching this are probably going to think I'm nuts, but this is real. So anyway, Dr. Bullock, he wrote a book about it. It's very cool. And it kind of brings home the message that in a way, we are gathering energy and creating ATP via sunlight exposure. So that was sort of like full circle for me. And then I saw you and you were like, melanoma is genetic more so than it is sun exposure. And I was like, hallelujah.
I'm not familiar with the term, but what you're describing I mean, physiologically, it makes sense. It's what happens. Our nerves transmit according, I guess, it works with, the levels of electrolytes in our body. And so, what you're referring to, it happens constantly in our body. So it makes sense. I'll have to look at the book. It's interesting.
Oh, it's so fascinating. When you go down that rabbit hole, you're going to be like, it makes a lot of sense. I was feeling this in my patients because my background's musculoskeletal medicine, and I would feel a turgor in the tissues that I could, or lack of, I should say, in most cases. And I thought it was that they were under muscled or they were not, I don't know, maybe they weren't fit enough, but some of these folks had really good muscle tone, but they were flaccid, and other folks had really good turgor in their tissues. You probably felt this too, now that I'm telling you. And I believe it's the structured water. I believe some folks really have a healthy structured water, and other folks are quite depleted. Things like EMF, things like blue light, those will destructure your water. So, and this is real. Like, this is not a made up thing. He's proven this. So really interesting concepts and how they play back into health. And I wonder what that impact is on the skin at the end of the day, and since that's really our UV filter. So I don't know. Anyway, I'm going off on randoms.
No, I agree. We feel for skin turgor all the time. I mean, we're constantly feeling for that because, fluid status is so important in so many of the diagnoses that we, are constantly seeing. So no, I understand exactly what you're referring to.
Yeah. You'll dig it. I'll get you the book and you'll get your mind blown. Okay, so enough about that. Let's move on because you've also talked about some other fascinating things. You were talking about using zinc and zinc status and how that plays into how well somebody responds to neuromodulators like Botox or Dysport. And that's also what grabbed me because my audience is always asking me to do an episode all about this, but I want to just touch on it with you because I do use neuromodulators sometimes. I have used them more often in the past than I do now. I am a little more concerned about them now and maybe their systemic impacts on my immune system because I have had some funny autoimmune stuff really flare up in the past few years. So I'm a little more wrinkled than usual because I don't know. I think I use it once a year now instead of 3 times a year. And my audience freaks out and they're like, you're supposed to be holistic, but I think Botox is preventative and I think it actually has some benefits. So anyway, that's my take on all of it. I want to hear about zinc. I want to hear about your thoughts around neuromodulators and safety, and just take it away.
Sure. So zinc is actually an easy way for us to support this chemical reaction that we induce when we use Botox. So essentially, zinc's this cofactor. If we've noticed that patients, when they're deficient in zinc, Botox just doesn't last nearly as long. And so oftentimes we'll recommend that patients will take zinc supplements every day, and it will definitely increase the duration of Botox. That's one of the easiest way to increase the duration of Botox. There are other things we can do. Someone did a study recently, I think maybe a year or so ago, where they actually injected Botox and had the patients exercise the muscles that they injected into. And they found that if you exercise the muscles they injected into, the Botox kicked in sooner and lasted about the same length of time. So point being, there are actually, quite a few things you can do to have Botox last longer. And especially when Botox isn't the cheapest thing you can, get, and you want to make it last as long as possible.
What do you think about these younger and younger and younger women using it? Like, I'm seeing women in their 20s and early 30s. I don't know if you've been to Los Angeles recently, but everybody looks eerily the same. Like, all the injectors have the same style, I guess, because the filler and the Botox in these young women is shocking and somewhat disturbing. I'm not trying to judge anyone, but I'm like, whoa, what is going on here? What are your thoughts on that? Because there's some concern that people could develop either an immunity to this or even potentially have some sort of allergic reaction, or I'm hearing about people having like Botox illness. I don't know what my thoughts are on it, but I'd love to hear yours.
You mentioned a lot of things, that I'd love to address. First and foremost, I couldn't agree more. If you can look at someone and know that they've had work done, something's gone wrong. Anything that I would like to do cosmetically, I would hope that no one would be able to look at you and say, "Oh, wow, she got work done," or "Oh, she got her lips filled," or "Oh, she got she got a cheek filler." That's really not the goal whatsoever of getting any sort of cosmetic work. So if you can walk around LA and you can see 20, 30-year-old women with, an obviously frozen face or with filler, it's not how you should look with cosmetic work. And unfortunately, for every botched cosmetic job that occurs, that person is like a walking billboard outside for how poor cosmetic work can be. And they're just not unfortunately, people don't have a good or realistic understanding of how good people can look with good cosmetic work. So point being, because if they look good with, filler or with anything else that we can do, they're not going to be running around shouting, "Hey, look, I got, this done. This is how I look." So unfortunately, everyone just doesn't really have a good understanding of what we can do for you. For the 20 and 30-year-olds also, Botox, filler, there's much more than just Botox and filler. I love the human body. I think the human body can do lots of amazing things just on its own. Sometimes we can kind of give it a little kickstart. I absolutely love lasers. Peels are nice too, but I think lasers are a little bit more controlled than peels. We use lasers to just create tiny, tiny, tiny little injuries in the skin. And then we let the skin just heal itself, grow back, and it works fantastically. We get amazing results. For a 20, 30-year-old, that would probably be something that I would, lean to much more, rather than skipping right to Botox or filler. Don't get me wrong. If someone, wanted to spend lots of money on things, I would do Botox and filler in that age group without a doubt. But if they saw their best friend, a month later, their best friend would be like, "Oh, wow, you look like you got a great night's rest yesterday." They wouldn't think, "Oh, you got your lips done." It wouldn't be like that.
What are the indications for laser? Like when would you recommend that for somebody? Is it when they have textured skin or acne scarring, or do they need a freshening? Because I usually think of because I'm 50, I usually think of laser for older women. So it's interesting to hear you say that about younger women. Like what are good indicators that would make you want to suggest that for someone?
We've got so many lasers for so many different things. If you were to go see some like private practice dermatologist might just have one laser, and it's, one laser just kind of do everything, but maybe not do anything very good. What you really want to do is go to a place with lots of different lasers that do lots of different things. And with these lasers, we can treat dark spots, we can treat rosacea. That's one of my favorite things to do. We've got a laser that specifically targets anything vascular. So if you've got those little cherry angiomas on your body, those little red marks that people just hate because they pop up everywhere as you get older, or like I said, just the rosacea on the cheeks, on the forehead, we can just give it a good zap and it will go away. People might need one treatment. They might need maybe 3 or 4 if it's bad, and it works fantastic.
Amazing. I'm so excited right now. Well, that's why I contacted you. I'm like, I need you. I need you to treat me. And you're like, I'm not in Oregon. So find lots of lasers. How do we do that? Is that going to be more of a hospital setting, or is that going to be more of a big clinic? Like, how do we go about finding a laser?
It could be either or. Unfortunately, I'm pretty familiar with the Portland, Oregon area, and I don't think there aren't very many locations down there that do it. But normally you can find a big institution, a big hospital, and more than likely they're going to have multiple lasers to choose from. If you go to a really nice, big cosmetic clinic whether it be plastic surgery or dermatology, I'm biased obviously towards, the dermatology part, but I mean, better than anything, you could get a group that's, plastic surgery and dermatology. But normally if it's rather large, they're going to have multiple lasers to choose from.
Okay, I'm on it. I might have to come see you though. I might just travel because I think this is great.
I have to say, if you choose the wrong, if you're treating rosacea and they use the wrong laser because they don't have the right laser, it's just not going to work very well, and it might be worse after they treat it. Which I hear just yesterday, someone told me that it's really a recipe for disaster.
That's my concern, is that it's such a fine line, and as we age, our skin starts to get thinner. And I've had some people say, oh, use the Morpheus 8, and others people say, don't use it. It'll dissolve your fat pads. And there's just all these conflicting ideas out there, and I know it can be confusing for people, but let's talk about that a minute. So there's some of these radio frequency devices or devices that do a deeper penetration and a heat. What are they trying to accomplish, and what could go wrong there?
So usually you're referring to radio frequency microneedling, and what they do is usually it has some sort of microneedling up top. I guess there's thermage also, but so radio frequency microneedling, there'll be like a microneedling. It's not like the little pens that you see in the med spas. It's not like that. It's a laser where basically it will treat the top of the skin, and then it's got this longer wavelength that penetrates the skin, and what it does is it tightens the skin. So we love these RF microneedling devices because it does a great job at tightening. So if I have a patient come in and their main complaint is they just want to just tighten the skin, just make the skin look tighter than it was before because maybe it's just getting a little bit saggy, that laser is perfect for it. There's also something called like thermage, which is kind of like that, but without the microneedling on top. Not exactly my favorite. I think microneedling, RF microneedling is probably what I would default to for that, but that's what those are for, and they're great.
Okay. Yeah. So Dr. Tony Yoon also likes those. So that's 2 for 2. I'm going for it.
But I have to say, there are so many lasers that we could spend time talking about. There's just, the normal ablative lasers that are probably my favorite, like the Fraxel Dual, where they just essentially, they're just causing very, very, very small injuries to the skin. And that's also going to cause tightening. Maybe not as much tightening, but in addition to that, it's going to do a ton for, texture, any scarring, any pigmentation, just basically anything you'd want for your skin. It'll just, go through and just take care of for your skin. We see amazing results in just one treatment. So there are lots of lasers to choose from.
And can we do this to our neck and our chest as well? Do you treat those areas when you're treating the face?
Such a good question. Oftentimes I'll see patients, I guess people in general, I feel like they treat the face and then they just neglect the neck. And you see them, it just doesn't look natural. It doesn't look right. They've got, this good looking face, but then they've got this neck that just looks 40 years older than their face. The neck is super important to treat, and so is the chest. I think you should really be focusing on everything.
I agree. Well, this takes the brunt of the sun exposure. So this started aging. My chest started aging on me first in my 30s. That's when I noticed like, oh, I maybe don't want to be hanging in the sun so hardcore. And then everything just started falling. So I need it all to come up. And then there's just these little, like you said, like these little cherry angiomas and like little things that pop up and telangiectasias and like little bumps and pores and things just start to really show themselves. And it's a bummer, it's like you've been beautiful your whole life. And then all of a sudden you get really close. I don't need the 10 to 20 times. It was when I got the magnifying 10 to 20 times magnifying mirror. I was like, whoa, there's a lot going on here, Yeah. So it's just a new world. And I think it's lovely that there's things that we can do to intervene. And I do think some people go overboard though. That's the other thing. Women in my age group, it's such a hard line because I always love the idea of looking fresher and brighter and, just a bit more beautiful and really showing good vitality. And I think that vitality is from the inside. That's hormone balance and good nutrition and exercise, because strength training will tighten your skin too, But women my age are really going off the deep end with a lot of filler and a lot of Botox. And my concern is 2 things. I'm afraid, especially with this, injections. Well, the masseters, they're doing a lot of masseter and platysma injections. And my concern is actually the health of the mandible, the bone, the bottom jaw, because men too, but as folks age, that mandible starts to dissolve because of osteoporosis. Mm-hmm. The tooth gets loose in there and their teeth start falling out. And they all say, oh, it was bad dental work 20 years ago. I'm like, no, you have severe osteoporosis. And so if you and muscle is what causes bone to stay strong, right? It's the tension on the bone. And so if you start blasting these women in their 20s that are taking out their buccal fat pads and injecting their masseter muscles and, really just trying to slim out their lower jawline, I'm like, your teeth are all going to fall out when you're in your 60s. And then all these women with this massive amount of filler that's so swollen looking, and then it starts migrating and they're looking weird. Like these close-up camera shots of some of these famous people that have been doing it a long time. I'm like, oh. So I don't know. I mean, I think there's a elegant way to do this, and then there's just a disastrous way. And so I've been hesitant because I don't know. I don't want to end up being one of those horror stories, you know?
I couldn't agree anymore. I think moderation in everything, and I think you're also not alone in talking so much about, your general health and your skin. It's much easier to just, amongst friends to talk about it. But as, in dermatology, as, a dermatologist, patient goes to see a dermatologist, it's not always accepted. That type of advice is not always accepted or, I guess, welcomed happily. Oh, you just need to change your general health. It's much easier to give someone a cream, or it's much easier to recommend, Botox or something else. But I couldn't agree with you anymore. Our general health, our diet, all that plays such a huge role in how we look. And it's certainly something that, the vast majority of us need to change.
And just hormonal status, just applying a topical estrogen cream, like the type that we can prescribe for vaginal health on the face, all of a sudden the skin just tightens up. And it's miraculous when women's hormones, and men too, when hormones are on board, things hold. And when they're not, everything starts to sag. And I joke with my husband. He's like, I don't know why you put all those fancy serums on your face. And I'm like, if I just cut alcohol and any inflammatory foods out of my diet for a month, my skin looks better than hundreds of dollars worth of serums every night. It really is. And if I fall off the bandwagon with my hormones, if I kind of get lazy about using them consistently, it shows up on my face and my skin. So I don't know, there's so much to this, and I think it's all of it. But for women like myself who do take very good care of themselves, it's nice to know that there's these options out there that can help us sort of, keep the clock from moving too fast. I'm really not trying to look 25 by any means. I think that's the other problem is a lot of look at Demi Moore. She looks fantastic, but I'd really love to get up close to her, and I'd love to see her lab work, because I just think trying to look like you're 25 when you're 60 something is, I'm not one of those. Yeah, I'm not one of those women who's like, you're 50, you shouldn't be in a bikini. Like, I'm not saying it like that. I'm saying it like, I'm more of the Sarah Jessica Parker take, where she's just aging, like she's just letting herself age, and the press is coming down on her, and she's like, what do you want me to do? I'm in my 50s. Like, what do you want me to look like? And I think, Addie McDowell's another actress. I don't know if you know who she is. She's older and she's really aged beautifully. And I'm kind of going for that look. Like, let's just age the best we can,
Yeah, no, I agree. I don't think 65-year-olds should be striving to be 25-year-olds. I think we should all just be striving to be happy with ourselves and who we are. And I don't think, changing a little bit about how we look on the outside, I don't think that's wrong. I think if it makes us happy, that's fine. I also think if we're obsessively, fixating on what we're, on what we look like, I think that could also be negative. But I think it could, doing a little bit, I don't think harmed anyone.
Yeah. It's the obsession. It gets exhausting. I've been in the throes of that, where you're like constantly on a Botox schedule, constantly getting your facials, constantly getting your lashes done, all of it, and after a while you're like, this is expensive and exhausting. I just want to be 40 something. I just want to be 50. Like, I just want to roll with it, and also not get skin cancer and not have terrible things happen, right? Like, we want to have robust and intact health. Okay. So I have more questions for you. What do you think, though? Let's go back to the Botox. What do you think about doing it too often? What can that lead to? Could it eventually stop working for people? And have you seen anybody actually develop? I've only just heard about this from a few young women, actually. They've said to me, I have been doing a lot of Botox for a lot of years, and they're in their early 30s, and they now are getting sort of like a post-injection sickness that's really throwing their immune system off course. And I don't know what's going on there. They're not my patients. These are just people I interact with. Have you seen any of that?
So let's see. I'll start with the first question. The first question was, can you get it too often? And it's funny because really that was my first Instagram video that really took off and got a lot of attention, which is funny because I didn't think it was anything special. In fact, it's really kind of common knowledge, I felt like, around here, at least where I work, that this happens. To give you a little perspective, we're oftentimes doing surgery. A few times this has happened, but one time comes to mind. We were just removing a cyst in the forehead in someone who had done Botox just religiously every 3 months for years and years and years and years. And I have to say, she probably looked her age, maybe even worse, despite doing Botox that often. I don't know, she just looked kind of frail. And when we, opened up her skin to remove the cyst, there was the muscle, the frontalis muscle, it wasn't even there. And I remember looking over to my colleague and just thinking, like, do you see this? Like, usually you have to dig a little bit, move the muscle. Her muscle wasn't even there. I mean, it was gone. We couldn't even believe how much it had atrophied. And we see cases like this all the time, maybe not to that extent, but point being, if you are just overusing Botox over and over and over again, if you're unable to use your muscle, it's going to shrink. It's going to get smaller because you're not using it. And on our face, if our muscles just disappear in certain areas, we're going to look weird. So if we overuse Botox, yes, we will look weird. You should really just use Botox as much as you need. Everything in moderation. You can't just, if you just say, you know what, Botox makes you look better, I'm going to get Botox every day from now until I die. It's not. It doesn't work like that. It's not going to make you beautiful. You should use as much as you need and call it good.
I think that there's the component of, I don't know what the word is. I'm a recovered anorexic, so I understand it very well. Like it's some kind of body dysmorphia, where you just can't see right in the mirror. And then I think on top of it, injectors, if you've got someone showing up every 3 months with cash in hand, you're not going to turn them away. So I mean, it's like Ozempic. I'm sure you've seen my content around Ozempic, and people get so angry, and I'm like, well, yeah, there's going to be abuse, because that's how anything works. They don't understand that patients will abuse, doctors will allow abuse, or doctors maybe won't stand up to patients, and it happens, but that's not the vast majority of people. These are the isolated cases you hear about. And I agree with you. When you atrophy the muscle so much, like I was saying, I'm worried about the osseous structure and their teeth later in life, but I'm also very concerned about all that skin sagging. That's one of the reasons I laid off, because I was like, if I atrophy all of this too much, everything's going to fall. And maybe it has to some degree because of I was using Botox back in my 30s all the way up through until about 2 years ago, really regularly. And I think that I probably did atrophy some of the muscles a little too much. It's really crazy that nobody talks about this. And you did. I was shocked actually when I saw that reel. I was like, nobody's talking about this. It's so taboo. I bet if you had 100,000 followers and you posted that video, you would have gotten so much hate. It's a different world.
Well, that's what's funny. I really just started my Instagram account really like a couple months ago, and that video got a lot of attention, and now I see all these Instagrammers that have a ton of followers, and now they're kind of reposting like the same idea, and it's just kind of funny to think that they used the same idea I did. But yeah, I didn't even think it was a shocking video, because like I said, around here, us providers, this is common knowledge. This really isn't something new. I guess we didn't realize that this was something that patients didn't understand. So I'm glad that now, we're all on the same page.
And there's also the neuromuscular feedback to the brain, where this is something I speculated a long time ago, and we have data to support it. Like folks getting Botox in their glabella muscle, which is the, frowny one for the audience listening, the one between the eyes where you look frustrated and grumpy and angry. Smoothing that out with a neuromodulator significantly reduces depression symptoms and improves mood, which is fantastic. However, if our muscles, and I think our muscles all over our body, but particularly our facial muscles, are so intimately tied to our brain and our emotional centers of our brain, that if we start freezing and putting in so much filler or some of these, Sculptra, some of these other more cement-like injectables into our face where our face is not moving, then we are no longer experiencing a plethora of emotions potentially that we would otherwise. And I think a little bit can be helpful in the cases of some of these studies around depression or low mood and anxiety, but also like I worry about some of these older women whose faces are so frozen. There's just no, like my husband will go to conferences with me and he's just like a farmer. He's like, what the fuck is wrong with that lady? I'm like, oh no, she just has a lot going on with her face. And he's like, it doesn't move. I'm like, yeah, I know. So these are things I think about too, because we want to have that emotional feedback to the brain, and that will come when we can smile or frown. And if you can't do any of that, you're not really getting that neurotransmitter release. I don't know. What do you think?
No, I think you're totally correct. I totally agree, and they've done studies about this. It's actually, really funny. If you can't physically frown, you your brain's actually going to think that you're actually not sad. You're actually happy. And actually, I wanted to make a video on this a couple of weeks ago. I can't obviously show you the pictures now, but I've got a really prominent frown, and so I put Botox into the muscles that make my mouth into a frown. And so today, if you notice, I really can't frown. I look ridiculous trying, but I really can't pull my mouth into a frown. And so there's the facial feedback hypothesis, or facial feedback theory, which says, if I can't really frown, it can't, my muscles can't really tell my brain that I'm actually sad. So it's actually really cool, and it makes sense if you think about it. And also they've done studies on top of this where we also mimic people when they make facial expressions. So if someone were to be sad, we would, to a certain extent, mimic that expression and then send that to our brain and then interpret their expression. And with these studies, they had people rate or interpret pictures of people that were angry, sad, or neutral. And then basically they froze their face with Botox and had them do the same thing. And they found through MRIs that their brain was working differently, suggesting that getting Botox might actually change the way that we interpret the emotions of others. We're still learning about this, and so there's going to be more research that needs to be done, but it definitely suggests that getting Botox ourselves might change the way that we interpret or analyze the emotions of others on their faces.
Wow. So we might not be able to express empathy or interpret their empathy. There's so many implications to this that it goes so deep. Speaking of, Tylenol actually blunts empathy. So think about that. Like, you've got somebody Botoxed up who can't express it or mirror back any empathy, and then they're maybe on a ton of Tylenol for pain and they don't even feel it. I don't know. I mean, there's just, we live in a strange world. Interesting. Super interesting. Facial feedback theory. That was the words I was looking for. My long description of what it was. I love that. Okay. So what about it not working in the long run, like for women who've been using it for a long time? And then what about potential immunologic reactions?
So actually, I've seen this quite a few times. I've seen it a lot, most often in, like you said, someone who gets Botox a lot. So, where I work, it tends to be oftentimes some of the dermatology nurses, because of course they're the ones oftentimes getting the leftover Botox. But essentially, we'll go to give them Botox and they just really won't respond very much, or maybe just a tiny bit. And of course, it just, suggests that they've developed antibodies to the Botox, which is really not fun because they're not going to respond very much to the Botox that time. And really I'm not sure how long it wears off. I'm not sure really anyone knows, because no studies have really looked into this, but it really doesn't wear off for any time that I know. It stays there for a long time. And the alternatives are to try a different type of Botox, which can get expensive, but really that's the only alternative. That's why I suggest that no one ever get Botox when they're sick or when they've recently had a vaccine, because your immune system's just a little revved up. And there's a higher chance that that immune system will develop antibodies against Botox when you get it.
Ah, yes. Didn't you do a reel about that? I feel like
I did.
Yes, you talked about that. I thought that was brave of you to mention. Yeah, it's real.
I feel like lots of people they'll come in, the patient will be sick or maybe had a vaccine and a vaccination. And I feel like providers oftentimes are just, wanting to get the injections done, get paid for it. And they're not really thinking about what's best for the patient.
Yeah, absolutely. Well, I don't think most people should mess with anything after a vaccine. There's a lot of immunology going on there. Like their immune system is doing a whole thing and messing. I won't treat patients. When I was doing regenerative injection therapies, I was really picky about who I would and wouldn't treat. I would not treat them if they had an upper respiratory infection. I would not treat them if they had a recent vaccination. I wouldn't treat them if they had maybe like a UTI. And folks would get mad and think, well, that's completely unrelated. What is my shoulder? Because I was doing like prolotherapy, PRP, stem cells. What does my shoulder have to do with my bladder? And I'm like, it's all connected, honey. it's all one big immune response. So we don't want to be too many cooks in the kitchen. We don't want to mess anything up and send someone over the edge. So what about that? Have you seen anybody come in and say, I've been doing Botox for years, and then the last time I got it, I've just been really sick ever since? Have you seen any of that? Because I'm hearing about that, and I believe the people who are telling me it firsthand, but like I didn't even realize this was happening.
I do believe it's happening. I'm always very careful to have an open mind. I've learned through the experience of others and myself to a certain extent that you really should always have an open mind and listen to what your patient's telling you, because it's not like they make up things to get some sort of reaction. I have heard of this happening. I've never actually personally experienced it from one of my patients. My hunch is that, I don't know if you're familiar with any of the counterfeit Botox issues that are going around right now.
Yes, I've heard.
They're having some serious problems with it. And my hunch is that there are providers out there that are using the counterfeit Botox, which is a lot different from, the FDA approved Botox that we use. And it could be it is very, very dangerous. I have a hunch that it's probably stemming from using that type of Botox. Again, I can't say for certain, but the FDA approved Botox that we use, we've been using it for a long time now. And relative to all of the other procedures we do, we really don't see very many complications from it relative to filler, lasers, the other, surgical procedures we do. Botox has a really relatively low side effect profile.
Okay, that's good to know. And, for the listeners, vet your injector and make sure that everything's on the up, because, yeah, you're right. That the companies that sell this stuff do not make it easy to get a hold of either. Like it's funny how often they make you reapply or reconfirm your license or reconfirm your clinic standing. So it shouldn't be something that a med spa can easily, I don't know, that's a whole other conversation we don't have to get into, but it's really baffling to me to see what med spas get away with. And there won't often, and I'm not trying to bash all med spas because I know that some are really by the book, but man, just from what I know of friends who've been medical directors themselves and how often there's no actual medical provider on site and, or overseeing physician, I should say, it just gets a little dicey. And I think that especially young women who are looking to save a buck, or maybe they're using Groupon and they, it's kind of, they're going into these like 7-Eleven type places that are med spas, and all kinds of hell can break loose there.
There are some great med spas. Unfortunately, there are a few that just ruin it for everyone.
Mm-hmm. Yeah, it's too bad. That's concerning. So you were sharing a story with me because I was saying that I felt like you really had a unique perspective and you had good common sense. And dare we call you holistic? Your colleagues might give you some crap for that, but I think you really are. And I think you take a different stance. You're looking at the individual as an individual. And that's what holistic medicine is. Like, you're not just looking at their face or this or that. And it's the idea that medicine isn't in isolation. It's, it's all one unit. It's a person. We say in naturopathic medicine, we're treating people, not conditions. I'm trying to get the person back to homeostasis because that's why they're presenting with symptoms. It's far more interesting to me than a diagnostic code. Anyway, you were talking about how, maybe some of the way that you think is stemming from a personal experience you had or that family members had in the medical system.
Yeah, sure. With medical care, not every treatment we do is necessary. A lot of it's elective. For example, surgeries sometimes are not necessary. You make decisions kind of guessing whether or not it's going to help you or not. don't get me wrong, sometimes surgeries are necessary. We need to do them to save your life. There's also kind of a gray area with some surgeries where you're kind of trying to guess whether or not it's going to be best for you or not. And within the last few years, there have been a couple decisions that were made by physicians treating a couple of my loved ones that have just really affected me. And I feel like that's kind of what drives how I make decisions with my patients. I've come to realize that some patients see physicians and they just want to start every treatment they can for what they come in for. And I've learned that, when a patient comes in, I'm treating the patient. I'm trying to figure out with the patient what will be best for them and whatever they're coming to me for. I've realized that the answer is not always to just chop everything off of the skin that doesn't look pretty. I've realized that sometimes it takes just discussing with the patient and trying to figure out exactly where they're coming from and exactly how we can meet their goals with our treatment options. Not necessarily me coming in and just saying, this is what you're diagnosed with. This is what I do for all the cases of this that I see.
I love that. It's so important. And it's important to give patients all their options. And again, risk tolerance, like have an open conversation and let patients make some decisions as well. It's funny though, not every patient likes that, right? I've had so many patients say, just tell me what to do. And I'm like, I'm not going to just tell you what to do. I'm going to help you weigh all your options. I'm going to tell you all your options. It's called a PAR-Q. Like it's there for a reason. Like most doctors don't even talk about this, or patients don't know. Whenever their procedure is on the table, we are supposed to present what the procedure is. We're supposed to tell them the alternatives. We're supposed to tell them the risks. And then we're supposed to ask them if they have any questions. And that's like the legal way to go about things. And I really appreciate that, what you just shared, because I don't think a lot of folks do that. I've personally been really burned by dermatologists in particular. It's scary how quickly, even as a young person, I remember I was 17 and a half and my mom sent me to the dermatologist to have a mole checked. And by the time I left there, they had injected me with so much lidocaine. I ended up throwing up. I passed out because I was so unprepared. I didn't go in thinking anything was going to happen. And I went in having no food in my stomach. And next thing I know, they've cut like 3 or 4 moles off of my back. And I had this traumatic experience and I left and I came home and my mom said, what happened? And I was like, I don't really know. And I don't know, maybe I was 18. I don't know how it happened if I was 17. And I feel like I was in my junior year of high school. Anyway, my mom takes all the bandages off that night and I've got these giant, huge lesions all stitched up like Frankenstein all over my back. And I was devastated. I mean, I fell on the floor crying because my beautiful body it looked like I'd just been butchered. I felt like I'd been violated. And I kid you not, last night I was looking at the back of my neck in the mirror and there's still a big divot where one of these, it's spread after it healed. I've got this huge, big quarter-sized crater in my back still. And I'm so pissed off about that. And I had a lot of mistreatment in those years, those very pinnacle years. I was very much mishandled by the medical system. And so I appreciate what you say, because not a lot of doctors, I'm hoping that maybe more young doctors are thinking that way. But man, it just wasn't the case for so many of us years ago, right? It was like, doctor is God, do what he says or she says. And they do things to you without telling you anything. Next thing you know, there's a needle in your arm and you have not signed anything.
Yeah, I agree. I'm so sorry about that story. That's terrible. I can't imagine. I can't really speak for what happened because I wasn't there, but it's hard to imagine how you walk in without a skin cancer history and then walk out with 3 spots removed. I don't know. It seems strange.
It was this crazy lady. Every time I went in there, she cut on me. She also told me I was gaining a lot of weight on birth control. And she also told me it was because I was probably just meant to be a chubby girl and I was eating too much. So that tells us where her logic is. Anyway, all that to say, to this day, I am very hesitant to go into the dermatologist. And I'm scared of it. And I have had trauma from it. And so honestly, when I found your account, I was so pleased because I've been sort of on this journey of like trying to figure out skin and really optimizing my skin and aging well, like we talked about in the first half of this podcast. And so, or I guess the middle part. And I really appreciate your take on things because it's just common sense and you seem like a very honest guy. And I shouldn't say I don't think we see too much of that in medicine because I think we're seeing more of it. I think especially in the younger crew coming up, there seems to be sort of a freshening of humanity in medicine that I am excited about.
Yeah, no, I agree. I think nowadays it's more of patient and physician are more of a team. I don't think it was like that before. I think before it was more like the doctor is the captain of the ship and they determine what's going to happen. I think nowadays it's a little different.
Yeah, I hope so. And I hope patients will take more responsibility and help be part of that team because that's really important too. They need to take responsibility for their own health to a large degree. And they also need to make some decisions when presented with options and then take responsibility for those decisions. It's not all the doctor, right? It's not all, we're just there to, I always say I'm just there to be like a super cheerleader and help them on their journey to optimize their health. But the decisions they make, they need to actually live with as well too. So I don't know, it's convoluted.
I agree. I couldn't agree more.
Yeah. Okay, awesome. Well, I know that folks can find you on Instagram. It is Botox by Bullock, MD. So it's Bullock. Is that correct?
Yep.
Okay, I'm going to make sure that's in the show notes. Is there anywhere else that you want to send folks to check you out, or are you open to taking patients?
I'm pretty new to the social media game, and really it's just my Instagram. I've got TikTok and YouTube, but it's really just reposts of my Instagram. So I think if viewers want to see me, I think Instagram's the way to go.
Okay. All right. I'll send them all there. You're a dad and a husband, aren't you? You got a lot going on. So
yeah, we're busy.
Yeah. Okay. So for listeners out there, don't blow him up with a bunch of silly medical questions. Just, go enjoy his content because it's very informative and educational. So anyway, thanks so much for coming on the show today, making time between patients. I really enjoyed talking to you and I appreciate you being here.
Of course, it was a pleasure. Anytime.
Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtina.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtina.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.